Dream Team, it's your boy Neal back with another reaction video, guys. Here we are with the American healthcare system is a joke. And I completely agree with that title, because it's just ridiculously expensive. It's ridiculously expensive. People may be getting healed, but they're going bankrupt. They're going into super debt to have their life saved, and I think that's one of the dumbest things. But before we jump in, make sure you subscribe to the channel, ring the notification bell, get a video a thumbs up so it gets suggested. Social media and Patreon, all up top. You can subscribe to any of it. Put all the links in the description. All you gotta do is hit the link, follow me, talk to me. Love talking to you guys. And if you got a favorite video suggestion, you can subscribe to Patreon or drop it in the comment section. What we got?
I understand, sir, but there's nothing I can do about it. Go ahead and have a seat and wait, please, and thank you. Next in line, please. What brings you to the ER?
It says, point of view, if you can see, it says American healthcare point of view, emergency room receptionist be like...
I can do about it. Go ahead and have a seat and wait, please, and thank you. Next in line, please. What brings you to the ER?
Hi, yes, I got
a dog. Can I get your first and last name, please?
Okay, sure.
Give me 1 second. Ma'am, make sure you don't throw up. The restrooms are right across. Security, can you go ahead and give her a bag, please? Thank you. So can I get your date of birth, please?
Yeah, sure. No, 5...
Still don't pop out. You happen to have insurance?
No.
Can I get your ID, please?
Hold up.
Okay, I'm going to go ahead and give you this bracelet. Wait. Go ahead and put it on and have a seat.
Okay.
I understand you're in pain, but there's 20 other people dying as well. Ma'am, is that a blood puddle?
He didn't get the name, the date of birth, just type it away. What are you typing? He not giving you no information. Say, sir, I understand you're in pain, but there's 20 other people dying as well. That's how it be. That's how the receptionist be. But keep it
20
going.
Other people dying as well. Ma'am, is that a blood puddle?
I want to tell you what it's like to be a poor person in America with brain cancer. In America, if you have brain cancer and the damage to your brain is so extensive you no longer have function on the left side of your body, and there's no one in your family because you've already taken on caring for your younger sibling, there's no one in your family who can give you round-the-clock physical care. Do you know what they do? They discharge you. I am the only person who can speak for my mom. I am the only person who can look out for her. And I've been playing chicken with the American healthcare system for the better part of a month. I've made it abundantly clear, talking to people up and down the chain of command at the inpatient facility my mom is at, that there is nothing I can do. I am working 12 to 14 hours a day. I took in my little sister, she's my kid now. I also have a 7-year-old stepson. I got them into the same school. I have a 7-month-old. There's no one in my family who can give her around-the-clock physical care. And they said, well, you should figure it out.
Stop it, man. Stop that, because that's ridiculousness, bro. Like, that's just sad. If that doesn't, break your heart that because they couldn't afford, she can't afford around-the-clock care. She doesn't have the money for it. And the hospital just says, well, then we're just going to discharge her. You're just going to have to figure it out. Wow. Because you can't afford it, she can't. It's sick. It's honestly sickening, and that's why I talk about universal health care so much. Because you see it work in so much other countries where this is not a problem. They're putting the people over the profits. Why can't we do that? Because this is just a tragic story to hear, and you hate hearing about stories like this. And there's many stories just like hers, and it's just sad that we haven't did anything to change that.
Well, you should figure it out. I wanted to keep this account all bubbles and sprinkles and giant cookies, and I'm trying to, but this is not right. And I have used my backup account to reach out to people and ask, what am I supposed to do? How am I supposed to make sure she's taken care of? How could I possibly get her into a long-term facility? And do you want to know what Americans as a whole who have been through what I've been through have said. Don't pick her up when they discharge her. They said it's the only way that you can make that inpatient facility accountable and Medicare, Medicaid, whatever, accountable, is that it would technically be an unsafe discharge. And my best course of action is to just not show up. This is what it's like to live in America.
A few days ago, an American YouTuber named Camille Johnson took a picture of her sister's medical bill and posted it on Twitter. But when people saw the medical bill, they were absolutely shocked. Camille's sister was fighting a medical condition that she just couldn't get over, so she decided to go see the doctor. So Camille's sister went to the doctor, but when she got her bill back, she could not believe her eyes. She'd been charged $40 for a brief emotional and behavioral assessment. This charge should only be given out to individuals who actually receive evaluation and screening for depression, anxiety, and other mental conditions. But Camille's sister didn't receive this evaluation. All she did was cry in front of the doctor, and the doctor charged her for that. The doctor charged her $40 for crying and didn't even help her. And this fact went viral on Twitter, and people started sharing ridiculous things that they had been charged for in the American healthcare system. One person was charged $25 for the application of a medicinal bandage, which was literally just putting on a band-aid. Another person $1,900 for women's services, which was literally a pregnancy test. He even posted—
Stop it, bro. It's sick. How can you look at this and be okay with this? I don't understand how people look at this and they're okay with this. If you're okay with this, you have the money to afford healthcare. If you're okay with this, so this doesn't affect you. But this is absolutely sickening, bro. These charges are absolutely ridiculous. Like that. If that doesn't frustrate you, something has to change. It literally just has to change. And we had both parties in office, like you change it by voting. It's like, well, we've had Democrats in office, we had Republicans on, we had these parties in office. Nobody's changing it. So who do we vote for? This is just ridiculous, man. I don't even want to watch the rest of this video.
Person $1,900 for women's services, which was literally a pregnancy test. He even posted bills for proof, but something has to change.
In my mind, insert cash or select payment type. Use PIN pad to complete transaction.
Hey man, how's it?
That's facts. You lose someone, you get worried about getting paid.
Use PIN pad to complete transaction.
Hey man, how's it going? Well, I was supposed to do surgery today, but apparently I'm out of network, so the patient had to cancel. Out of network? What does that mean? It just means insurance won't pay for the patient to come see me for their health care. Oh, wow. I didn't know you worked for the insurance company. What? I'm in private practice. I don't work for the insurance company. You sure? Of course I'm sure.
Definitely.
So when you see a patient, you send a bill to the insurance company, right? Yeah. And then the insurance company will pay you for your services. Yeah, that's right. Well, who decides how much you get paid? Well, you have to sign a contract with the insurance company. Well, what happens if you don't sign the contract? You don't get paid. Huh. So you do work, and the insurance company pays you for that work, and they pay you whatever amount they decide they want to pay you for the work you're doing. Yeah. I don't know, it kind of sounds like you're working for the insurance company.
Hey, hon, welcome.
That's what you're doing. Working for the insurance company. The insurance companies run American healthcare.
I don't know, it kind of sounds like you're working for the insurance company.
Hey, hon, welcome back to the hospital. How can I not help you today? Hi, I chopped my hand off with the safety scissors again. Okay, and do you have insurance? No, I'm fine.
How much longer do I have to wait until they can put my eye back in its socket?
Just wait your turn! I remember when I used to chop off my hand with the safety scissors. What? Just put an ice pack on it and take some Tylenol, okay? Can I maybe get...
And that's $15. For that advice, we're going to have to charge you about $500. Tell you to put an ice pack on it, take some Tylenol, we're going to have to charge you about $500.
What? Just put an ice pack on it and take some Tylenol, okay? Can I maybe get stitches instead? Bye-bye. Okay, honey, so your total is $35,273.52. It's just gonna ask you some questions. You want me to tip at the hospital? And how will you be paying today? I only have Bobby money. Well, then you're going to jail. Security! Bitch, what the fuck?
American healthcare is a fucking joke. I've been
Facts.
having sinus issues and ear infections for 4 months now, and finally it was time today to see my ENT. After driving 40 minutes here and getting extreme vertigo anytime I get in the car, but managing to make it here safely, I go inside and they say, "Oh honey, your insurance is out of network. We can't see you." I said, "My insurance was confirmed when I made the appointment. What do you mean it's out of network?" She goes, "Oh, we take your brand of insurance, just not the tier level that you have."
Wow.
I said, "Okay, so what's out of pocket? I can't wait any longer. What's going to cost me out of pocket?" She goes, "We can give you a $300 discount for out of pocket. So today, up front, before we even let the doctor see you, we're going to need $430. I said, "I have to pay that all up front right now. There's no like payment plan I can sign up for." And she said, "Oh, well, we have a financial plan thing, but your husband makes too much. You don't qualify." But no one cares that my husband's income is our family of five's sole income. I was about
That's not gonna get you far. I'm not sure, but a family of 5, dude, he's got to be making a ridiculous amount of money for that to be the sole income to support a family of 5. He's got to be making great money, great. But it's just crazy. She confirmed that the hospital was in network. She gets there and they tell her that we accept the brand of insurance. We just not the tier that you have. What are we doing, bro? What are we literally doing out here? Like, this is just it's ridiculous.
our family of five's sole income. I was about to just freaking pay it, but then if I have to keep coming back, that's going to continue more cost. And my husband called and he's like, "Here's a number I found in network, give them a call." So I call them and they say, "We need the direct referral from your doctor." My doctor happens to be out on a business conference right now, so he can't do it right now. So I said, "Okay, well, how far are you scheduling?" She's like, "Oh, like a month out in advance." "Can you make my appointment now? And then when he gets back next week, he can send the referral?" "No, can't make an appointment without the referral." So now at a minimum, I'm going to have to wait at least another month to figure out what's wrong with me. Mind you, I was just in the ER on Sunday morning with all of this stuff going on. All the doctor treated me for was gastritis, which I had because I've been having nonstop drippage and stress. So he tells me that my vertigo is from having anxiety attacks. Bitch, I've had anxiety attacks my whole life. They don't cause me vertigo. So after spending countless money on doctor visits and suffering for over 4 months now, I still don't have any fucking answers. Again, I say, American healthcare is a fucking joke.
I got my arm
So
severed.
it's like, why won't you literally just help her? Why can you not just help her?
I say, American healthcare is a fucking joke.
I got my arm severed in a bear accident and I need a doctor.
Oh, we love a victim, queen.
I went to the ER, but the wait was 3 calendar months.
Have you tried the urgent care app?
I don't have my arm.
Oh no!
I know.
I'm sorry, a buggy just landed in my cereal. Can I put you in a brief holding pen?
No, I need someone to stop the bleeding.
So it looks like you're not in our system. Are you sure you exist?
You never asked for my
Oh
name.
my god, stop yelling at me. You're scaring me, queen.
Should I cauterize the wound on my stove or should I come into Kaiser Permanente?
Okay, hold your horses, miss. Should I cauterize my wound on my stove? I'm bleeding to death. Have you signed up for our Bing Bong points?
Oh,
What?
my Lord.
Every time you get mauled by a bear, you get some Bing Bong points, which you can use toward your next flu shot.
I already got my flu shot. I'm bleeding out.
Oh wow, someone's on their period. Do you need to go to the lady doctor, queen?
I mean, yeah, I've been trying to get an OBGYN appointment for like 6 months, but right
Our
now,
lady doctor is amazing. He has no availability and only 3 prior convictions.
I think I'm actually dying right now, so I would love to talk to a doctor. Name, Tyler. Birthday, April 16th. Insurance provider, I don't have insurance. Then it's gonna be $47,000. Oh, I don't have $47,000. We take credit card. No, listen, there's gotta be another way. Okay, fine. Can I just go get insurance and come back? You can only enroll in insurance during set enrollment periods. Okay, when's that?
What?
Last week. Just missed it. You don't understand. I really need this treatment, okay? When's the next enrollment period? Next year, same time. You don't understand. I can't wait that long. I'm literally dying. You can always call our hospital's financial assistance office and speak to them. Okay, fine. What's the number? They're not in until Monday. No, I really don't think I can. Next.
It's honestly a joke. It's ridiculous. There's people suffering who just can't afford treatment, and the fact that we could just turn them down or discharge them or all of these things, it's putting profit over people. The insurance companies are basically who run the hospitals. Basically ran by the insurance company. Only care about profit. Freak the people. Especially if you don't have the money to pay, then I'm sorry. Figure it out. That's such a sad way of seeing things. I don't even know what to say. That's all we got for this one. You guys got a favorite video? Drop it in the comment section or subscribe to Patreon. I got social. Make sure you subscribe to the channel, ring notification bell, get a video a thumbs up so it gets suggested. Social media, Patreon, all up top. You can subscribe to any of it. Put all the links in the description. All you gotta do is hit the link, follow me, talk to me. Love talking to you guys. You guys are the most incredible team on YouTube. It's your boy Neal. Out.